Hi everyone, welcome back to my YouTube channel. Today we are going to talk about thoracic vertebra. So let's start our topic with introduction. Thoracic vertebra are series of 12 vertebra that are located between cervical and lumbar regions of the spine. They form the mid-back portion of vertebral column and are labeled T1 to T12. These vertebrae are unique because they articulate with the ribs, thus forming the posterior part of thoracic cage. Thoracic vertebrae play a crucial role in protecting vital organs such as heart and lungs while allowing limited movements compared to other regions of the spine. Location and number of thoracic vertebra. Thoracic vertebra lie between the cervical vertebra and lumbar vertebra. Cervical vertebra is present above the thoracic vertebra while lumbar vertebra is present below the thoracic vertebra. They are numbered T1 to T12 from superior to inferior. So the superior thoracic vertebra is numbered T1 and then T2, T3, T4 and the inferior most is the T12 as you can see in the diagram. These vertebrae gradually increase in size as they descend, with T1 being the smallest vertebra and T12 being the largest thoracic vertebra. General features of thoracic vertebra. Thoracic vertebra share certain characteristics that distinguish from cervical and lumbar vertebra. They include vertebral body, vertebral foramen, pedicles, laminae, spinous process, transverse process, and articular fascias. Now let's talk about these general features of thoracic vertebra one by one. So first feature of thoracic vertebra is vertebral body. These bodies of thoracic vertebra are heart-shaped and are slightly larger than those of the cervical vertebra. They are designed to bear more weight than the cervical vertebra but less weight than the lumbar vertebra. Each body has a costal fascias that is also called as demifascias on its sides for articulation with the head of ribs. Then the second feature of thoracic vertebra is vertebral foramen. It is circular and smaller compared to that of the cervical vertebra. It has a third feature of thoracic vertebra is pedicles. Pedicles are directed posteriorly and are slightly upward. They have shallow superior notches and deeper inferior notches, thus forming intervertebral foramina. Third feature of thoracic vertebra is laminae. The laminae are thick and overlap one another, thus reducing movement in this region and aiding stability. Fifth feature of thoracic vertebra is spinous process. Their spinous process are long, slender, and directed downward, thus giving the thoracic spine a characteristic overlapping pattern. Sixth feature of thoracic vertebra is transverse process. Transverse process are strong and have fascias for articulation with the tubercles of the ribs, except for T11 and T12, which lack these fascias. Seventh feature of thoracic vertebra is their articular fascias. There are superior articular fascias that face backward, while the inferior fascias face forward. Their orientation allows for rotation but limit flexion and extension movement here. Now let's talk about unique features of thoracic vertebra. Each thoracic vertebra has rib articulation fascias, thus making this region distinct. They have costal fascias that are located on the sides of vertebral bodies, and these fascia articulate with the heads of the ribs. They have transverse fascias that are present on the transverse process of T1 and T10, T1 to T10, and they articulate with the tubercles of the ribs. They are not present on the T11 and T12. Then there are variations among thoracic vertebra, as T1 resembles a cervical vertebra and has full fascia for the first rib, while T10 has a single costal fascia on each side. And third variation is that T11 and T12 have no transverse costal fascias and thus resemble lumbar vertebra. Intervertebral disc in thoracic region. Intervertebral disc is present between thoracic vertebra and are relatively thin compared to the lumbar region, thus contributing to less mobility in the mid-back region. These discs act as a cushion and help in shock absorption. Functions of thoracic vertebra. First function is support, as thoracic vertebra bear the weight of upper body and transfer it downward to the lumbar region. Second function is protection, as these vertebra contribute to the rib cage, which protects vital thoracic organs including heart and lungs. Third function is attachment, as these vertebrae provide articulation point for the ribs and attachment for back muscles and ligaments. Fourth function is stability, as there are overlapping spinous processes and rib attachment that enhance spinal stability. Fifth function of thoracic vertebra is movement, as these vertebrae allow limited rotation but restrict flexion and extension to prevent injury. Curvatures of thoracic spine. Thoracic region contributes to the kyphotic curvature of the vertebral column, that is curving outward to help balance body weight and protect internal organ. Clinical significance of thoracic vertebra. First is thoracic spine fracture. They commonly occur due to trauma and are often associated with rib fracture. Second is kyphosis, that is exaggerated curvature of thoracic spine and is often due to osteoporosis or poor posture. Third significance is disc herniation, that is less common in the thoracic spine compared to lumbar and cervical region due to its rigidity. Fourth significance is scoliosis, that is abnormal lateral curvature that often involves the thoracic vertebra. Fifth significance is costovertebral joint disorder, that is pain or stiffness that occur where ribs articulate with the thoracic vertebra. Conclusion of this lecture video. Thoracic vertebra are critical component of spine, forming the backbone of thoracic cage and supporting rib articulation. Their unique anatomical features, including costal fasciates and overlapping spinous process, ensure stability and protection of vital organs while allowing limited mobility. A solid understanding of thoracic vertebra anatomy is essential for diagnosing and treating spinal and thoracic disorders. And this was all about thoracic vertebra. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.